Hey everyone, and welcome to This Explainer. Today, we're diving into a genuinely fascinating solution that bridges a very real gap in modern medicine. We're talking about the space where strict medical safety collides with a patient's deeply personal cosmetic concerns. We're going to look at a brilliant yet incredibly simple piece of surgical design made specifically for cesarean sections. It's this amazing story about how one elegant little tool can completely transform the whole experience, not just for the doctor in the operating room, but for the mother on the table too. So, here's our roadmap for today. First, we'll look at the C-section cosmetic dilemma, then the anatomy of an incision, before checking out the Fawn and Shield template itself. After that, we'll dive into the simulated surgical trial and wrap up with the precision and confidence results. All right, let's get right into it. Section 1. The C-section cosmetic dilemma, balancing safety and aesthetics. To really wrap our heads around this, we have to look at the massive global footprint of this daily procedure. Back in 2015, massive global studies logged a staggering 29.7 million C-sections. That's roughly 21% of all births worldwide. And, that number has just kept climbing with advances in tech and shifting demographics. To give you a hyperlocal perspective from our source data out of Thailand, they see about 253 C-sections happening every single day. That means thousands of times a day, all over the world, surgeons are making an incision on a mother's abdomen. And with that sheer volume, well, you start to see a really fascinating split in priorities. And right here is the core conflict. Think about it. If you ask the medical team what matters most, the surgeon's priority is crystal clear, right? Fetal and maternal safety, preventing infection, managing blood loss, and doing it all quickly. But for the anxious mother undergoing the surgery, she has another deeply personal priority, the permanent scars she's going to carry for the rest of her life. Mothers care deeply about how it looks, if it's symmetrical, and whether they can easily conceal it under clothes, like swimwear. But honestly, too often, this very real cosmetic anxiety is just treated as an afterthought in a clinical setting. Moving on to Section 2, Anatomy of an Incision, Finding the Right Cat. When we look at the physical reality of the abdomen, there is a stark, undeniable difference between a vertical midline cut and the horizontal Joel Cohen and Fan and Steel approaches. Now, a vertical cut is great for one thing, incredibly fast access to the uterus, and it can be easily extended in an emergency. But it leaves a very visible, tough-to-hide scar. On the flip side, the horizontal cuts, especially the lower, slightly curved ones, are hugely preferred by patients. Why? Because they follow the natural lines of the body and are just so much easier to hide. Which brings us to the absolute gold standard for aesthetics, the Fan and Steel incision. You probably know it as the bikini cut. It's this curvilinear transverse cut made just 2 to 3 centimeters above the pubic bone. Because it sits so low and follows a gentle curve, it's pretty much every mother's top choice. But here's the catch. Cutting a perfectly symmetrical, curved line on a 3D, sometimes asymmetrical human abdomen is unbelievably difficult. Picture being a novice medical student or an intern. The mother might be carrying extra weight, the operating table might be tilted, or the baby might be extra large. Trying to freehand a flawless 15-centimeter curve under all that intense pressure, yeah, that is incredibly nerve-wracking. That takes us to Section 3, the Fan and Steel template, a blueprint for precision. So, to solve this intense anxiety over making a crooked cut, researchers at Barapi University came up with an absolutely ingenious, yet remarkably simple tool. We're talking about a transparent, 1 millimeter thick plastic template, shaped kind of like a teardrop. No electricity, no complex machinery, just pure, strict geometry. It features specific anatomical markers that align right up with the patient's belly button and the ASS. Those are the bony protrusions on the front of the pelvis. Up top, there's a centimeter ruler so the surgeon can perfectly dial in the length of the cut. But honestly, the absolute genius of this whole thing? The built-in bubble level. It literally guarantees that even if the surgical drapes are bunched up or the table is totally tilted, the cut will never be accidentally skewed. Oh, and it finishes off with a dedicated curved groove at the bottom, giving the scalpel a flawless little track to follow. All right, Section 4, the simulated surgical trial, testing the tool. Now, to prove this wasn't just some neat idea that only worked on paper, the research team set up a really rigorous randomized controlled trial. They brought in 32 medical students and young interns. Why them? Because that's the exact group that struggles the most with incision anxiety. They used a crossover study design, meaning every single participant acted as their own baseline.
Pretty smart, right? First, they performed a simulated standard surgery on a medical dummy using just traditional tools and their own raw spatial judgment. Then, they evaluated their own stress and confidence levels. After that, they crossed over and did the exact same surgery again, but this time they got to use that clear plastic template.
Which brings us to the results in Section 5. Precision and confidence results, the impact on surgeons and scars. Okay, let's look at the hard data. The researchers brought in blinded medical experts to evaluate the simulated wounds. And by blinded, I mean the judges had absolutely no idea which cuts were made with the template and which were just free-handed. The results were striking. Without the template, those novice surgeons had way higher variance. We're talking an 11% variance in length and a massive 19% variance in the angle. That leads to visible distortion and a crooked scar. But when they used the template, the variance tightened up across the board. The experts noted that the template-assisted cuts were significantly more symmetrical and aesthetically pleasing, with far less distortion. Turns out that cutting groove and bubble level did exactly what they were supposed to do. But this explainer isn't just about the physical scar itself. It's also very much about the humans standing in the operating room. The data revealed a massive, statistically significant boost in the self-efficacy and overall confidence of these young doctors when they actually had the template to guide their hands. Before using it, they were reporting higher stress and significantly lower confidence in their ability to deliver a perfect cosmetic result. But simply handing them this basic 1 millimeter thick piece of plastic, it fundamentally shifted their psychological state. It allowed them to actually focus on the safety of the delivery rather than completely stressing out over the complex geometry of the incision. And that really brings us to the broader picture here. I want to leave you with this final thought to chew on. How could other simple geometric innovations relieve anxiety and improve outcomes across all of modern surgery? This template absolutely proves that not every medical breakthrough has to be some million-dollar robot or a cutting-edge pharmaceutical. Sometimes, simply bringing empathy-driven design right into the operating room, design that actually listens to a mother's desire for a beautiful outcome and a young doctor's need for precision, can completely transform the experience for everyone involved. Thanks so much for joining me on this explainer, and remember to keep your eyes open for those elegant solutions hiding in plain sight.